He's a very low key, laid back kind of guy, but he spent about 20 years, uh, went through hospitals by starting out as a respiratory tech, and then liked what nurses were doing, did the AD and the BSN, MSN, and then started asking, why is healthcare so screwed up? And why are nurses not in charge of their own profession? And those were his two questions. He thought, okay, I'll do an independent PhD and I'll answer that question and maybe come up with an economic plan that could change how all of this is running. So in the meantime, he thought, oh boy, I don't know much about economics. I probably should get an MBA also so that I can speak to people. So he did all of that. And in the course of it, he came up with a plan in the 1930s. They had the same problem with electricity that we've had with things like the internet and, other aspects like that. It's like those big companies were happy to bring it to the cities, lots of money there, but they didn't want to bring them to the rural areas and to individual farms. So my grandfather was actually a recipient of electricity through the Rural Electric Association, which was a public utility model. We know it now in the United States, probably most closely by sewer and water, and in some places electricity. And so what he started to think is, could this model fit with healthcare? And with some, various tweaks, he was able to get it to match exactly the 7 goals that he had started out with. And so he spent 20 years tweaking it, working on it, talking to everybody he could talk to, doctors, economists, nurses, anybody and everybody, and was getting nowhere. And so when I had him on, I was like, these light bulbs are going off in my head and thinking, oh my gosh, why aren't people knocking down your door? So I started trying to promote him and realized how difficult it was to do. And then a couple of years later in 2020, I interviewed Kim Evans, who had been in an ICU. She was sick and tired of seeing all these chronic people coming back and back and back again, and feeling like all of these things could have been prevented. And
Yes.
she decided to go off on her own, got an APRN. She trained with some amazing people on nutrition and all kinds of things, and opened up her own integrative medicine clinic about 22 years ago.